Enero. Hello. Hi,
Hi,
Vanessa. Hi, everyone.
Hello.
good morning, Dr.
Hi.
Kumar.
Hello. Good
Good
morning.
morning to you all.
Good morning, good afternoon, good evening, wherever you are, everyone.
Yeah. Hello,
Yes.
everyone. Buenos días.
Are we
Go.
are we all that we are joining to this meeting?
I think from our side, Markan, is that all from my lab side?
Yeah, I think Rahul sir will join in some time. He is
Okay.
on another call, so he will join in some time.
Okay.
But from our side, sir, we all are here, sir.
Okay.
Yeah.
De la parte de Chaco, ¿están todas las personas que se van a reunir o esperamos a alguien más?
Estamos todos. Ya estamos todos.
Ok, bueno, pues entonces yo creo que vamos a comenzar, ¿sí? Thank you, Dr. Kumar. Dr. Kumar is an applications and R&D head, so he can give us a little introduction about himself, and then we can start the presentation, please.
Yeah, sure. We can start with Dr. Gautam Wankhede. He is the Director of Medical Affairs in my lab. Sir.
Hi, everyone. Good morning. As I was telling you, good morning, good afternoon to everyone. So I'm here. I'm Dr. Gautam. I'm the director of the company. Rahul, who is the CEO of the company, he might be joining us very soon. And then we have Dr. Markan, from the lab team. He heads the R&D of the company. We have Amrita, and I think with Markan we have.
Yes,
Uh,
sir.
I can't see who's with you, Markan, because the camera is not.
Amrita is here, and
Okay, hi, Amrita.
behind
Okay,
Prashant is here from engineering team, sir.
okay.
Hi, everyone.
So yeah. So what we'll do is, before we start the actual demonstration of the instrument, we'll just spend 5 to 10 minutes on a few slides to give you a brief background about the kit and the instrument. Is that okay with you, Itzel and others?
Yes, it's completely fine.
Okay. So can you share the presentation, Markan, if you have it?
Sure,
Because I
sure,
don't
sure.
have. Yeah. So, my lab, as you would be knowing, is an Indian company. We're based in west of India, which is in Pune. It's a company which was formed about 14 years back. We've been into hardcore R&D for all this time. And one of the first products that we developed when we started my lab was NatSpurt. NatSpurt, as the name says, is the individual donor triple H. Triple H means HIV, hepatitis B, and hepatitis C. Triple H nucleic acid test specifically directed towards blood donors, but we also have regulatory approval in India to use the same test to screen any patient suspected of having the disease. So it can also be used as a part of pre-operative screening. Okay, so this is a brief background about our solution. You can go to the next slide. I'll move fast because we want to move to the real thing, which is the actual demo. So this is our journey. As I was telling you, it's about 14 years back. We started with the R&D lab. One of the first products that we got out and approved was the NatSpurt. One of the major achievements of my lab was during the COVID pandemic when we were the first company in India to come out with the COVID PCR kit. It was soon followed by a large number of innovations, the COVID antigen test, the COVID self-test, followed by that. And then we had major investments into the company, one of them coming from Serum Institute of India, which is the largest vaccine manufacturer in the world. So we have got a strong backing from, very big companies. And we work a lot with the Indian government. You can see on the extreme right, our managing director, Mr. Hasmukh Rawal, he's with the Prime Minister of India, Honorable Narendra Modi. We work a lot with the Indian government for not only blood screening, but also for tuberculosis, which is a major problem in India, and I'm sure a little bit in that part of the world as well. So we have major solutions around this. We consider public health as a major focus for my lab, and we develop solutions around it, and we ensure that these solutions are actually implemented on the field. Let's move on, Martin. So these are various technologies, various products. So when we talk about MyLab, our focus is not just on the kits. We believe that a kit uh, for molecular testing works best when we offer an automated solution along with that. There are many manufacturers across the globe who have developed PCR-based kit, especially in the last 4 or 5 years since the pandemic. But very few are able to offer that on an automated walkaway system. We have Compact XL, Compact DX, the whole series of instruments, and other uh, you know other instruments that go along with it. The whole idea is that to give a seamless, easy to use experience to the user. Next one. Talking specifically about blood banks and screening for NAT. So I think uh, the major push came for it in 1980s when a large number of hemophiliacs lost their life, especially in Europe and UK, because of the tainted blood, because of getting HIV or infected blood. So the HIV pandemic, which kind of came out in 1980s, that was the first major impact. Eventually, everyone realized it's not only HIV, hepatitis B, hepatitis C is also being transmitted by blood. So that's when health authorities thought of going beyond serological techniques. We needed more sensitive techniques that were able to detect the infected donor earlier. Next slide. And that's when the nucleic acid test came into being. And why? Because as science says, the first thing that enters the body is a small amount of viral protein or viral DNA or RNA. After this, the body responds to it by forming antibodies and other things. So if you're looking for a test which is based on antibody, it might take about 4 weeks or up to 10 weeks to develop. If you're looking for a test where we are targeting proteins, then we'll have to wait for at least a couple of weeks for enough amount of protein to be available. But PCR, polymerase chain reaction, is a technology wherein we can take up a very, very small amount of viral nucleic acid and multiply it in during the test process outside the body and then identify it. And that's why in nucleic acid testing reduces the window period drastically. It goes down to days from weeks in case of HIV, HBV, and HCV. Also, what we've done is we've put an emphasis on individual donor NAT rather than pooling all the components together. So as a technology, what we've done is we've used a gold standard technology, which is the PCR, hydrolysis probe-based chemistry, but we've not tried to dilute that by pooling blood. We're not mixing 4, 8, 24 blood samples together, especially in countries where there's a slightly higher prevalence of these viruses in the community. It's important to go for individual donors. So that's what we've done. Next slide. And then we've offered these in the form of technology, in the form of automated systems. Next slide again, we can go to that. So our technology has been awarded. In India, we've got major achievements. Apart from the licensing, we were awarded by the National Indian Government in 2023 by the Department of Biotechnology. We got the National Technology Award for this. Next slide. And this is the instrument that we're going to show today. The whole idea behind this instrument is the instrument might look small to you, but the way we've developed this instrument is it's a modular system based on the workload. Not every blood bank in the country will have a workload of 500 donations or 300 donations a day. Some of the blood banks, especially in the remote areas, will only have 20, 25, 30 donations a day. And the bigger ones may have thousands. So what we've done is we've come out with a fully automated system, which is modular. So it has a throughput of, it has a capacity of 16 tests, but that does not mean we can only do 16 tests at a time. We can link instruments together, and all these instruments then run with a single software, and we can do as many number of tests as we can together. The turnaround time is just 3 hours, so you can put 50 or 60 or 64 samples, and 64 results will be out in 3 hours. And when they're out in 3 hours, we not only get a result,
Gautam,
but we also get, yeah.
Kanan here. Gautam, how are you? Good. Could you please be a little slower?
Okay.
Because I know that everybody understands English, but somewhat if you go like little slower and stop, and maybe it would be helpful to process it, for them.
That's fine.
It may be helpful. Yeah. Thank you.
Okay, got it. Okay. Apologies for the speaking a little fast.
No. So until the document certificates, it's okay. But now you are going to the instrument section, so it may be a little one by one. Would be really helpful, please.
Okay, yeah. So basically, in our instrument, the way we have designed the instrument is we've kept it as a modular instrument. So instead of having one huge instrument with a capacity of 60 or 80, what we've done is we made something like building blocks. So one of this building block has a capacity of 16. That does not mean that if a blood bank has a higher throughput, if it has more blood donations to be tested, we can only do 16 at a time. We can link these modules together, and all these modules work through a single interface, through a single computer. And then we can put up to 64 or even 80 samples together in one run. And the turnaround time for this is about less than 3 hours, just about 3 hours. So if you're putting 60 samples together, the first results will be out in roughly 3 hours. And what we also do is that we are also not only giving you a positive or a negative result, we are also differentiating whether it's an HIV, hepatitis B, or hepatitis C in the same run. So within 3 hours, we are also screening the patients, and we are also differentiating as to which particular infection is present in which particular donor. So this is how the instrument works. Next slide. This is an overview of our kit. It's a completely integrated kit.
Gautam?
Yeah. Yes.
So I don't know how you structured your presentation. Maybe each slide, maybe we will stop briefly and maybe to ask some questions, because of course they will come back later. But if anything like in this slide specific, maybe they can raise my team or from Chapo team, may be helpful. Rather than holding everything together and end up the conversation, maybe a little difficult. Vanessa, it's a Chaco team. Anyone have some questions on the previous slide, please?
You can go back, yeah.
We don't have any questions.
Okay. All right, then that's good. Thanks.
Okay.
Thanks, Gautam. Yeah.
Okay, you're welcome. So the next thing is the actual kit cartridge itself. Okay. What we have is an all-in-one, fully integrated cartridge. So when I say integrated, the steps involved in any nucleic acid test is, number one, extraction of the viral nucleic acid from the blood sample. That's the first step. The second step is the addition of our primers and probes, our actual reagents, which will go and stick to the target genetic areas that we are targeting. Okay, this is then followed by amplification. So then we do the actual real PCR process, and then this is followed by, as the PCR goes on, as the number of copies increase with every cycle, we keep on reading with the help of a fluorescence reader as to what is the fluorescence emitted, and then a graph is plotted. But this is the entire process. But from a user point of view, it is fully automated and fully integrated. So you do not have to do every process separately. You just have to load the samples, and then you have to load the cartridge you can see at the top into the instrument, and then everything happens automatically. So this is the actual cartridge you can see. If there's any question, fine, or we can go to the next slide.
I am fine. Thank you.
No questions.
Okay. Next slide, please. Yeah. So it's kind of repeating what I did in the past. So basically, you just have to prepare and put the sample inside the instrument. We put up the cartridges, and then everything happens automatically. Start the run button, and then you get straight away, you get reports after 3 years. You can download the report, or we can also connect the computer to a hospital or a lab information system, and the reports then will be pushed into the HIS or LIS. So if no questions, we can move to the next slide as well. This is the report format.
So this is the consolidated report format that you see for all 16 samples. Moving on, this is the individual results that you get for each individual samples as a PDF, system generated report. So as you can see here, we have liquid level detection as you have seen in the previous slides. So if insufficient sample volume is detected, it is directly reflected in the results, and the sample is determined invalid. In case it's detected positive, then with the warning, the positive is given.
Madan, so as a lab, you will have a full 16 reports automatically downloaded in a location. Then we can go by sample based report, right?
Yes, sir.
Okay, yeah. So okay, that's good. Maybe not right. I don't know. It's the right time. So when the lab using a barcoded system sample with their own limbs, so is it possible to integrate?
Yeah. Can I quickly go back to a few slides back where we will demonstrate this to you as well. So here you can see that this has connected to LIS system. Whatever this instrument is already connected via HL7 to LIS. In the demonstration also, we will show you the data that you can see remotely on a system. That can be pushed to any blood bank management system or hospital and management information system that the user has.
Okay.
This is fully configurable.
Okay. Yeah. All right. Good. Yeah. Go back to the report. Go back to the report, please. Okay. So even though you are making a quantitative results, but the report will come with a quantitative or a qualitative report.
Sir, this is a qualitative essay. This is a qualitative essay. This is not a quantitative.
Screening is a qualitative. Okay. Screening is a qualitative. Yeah. Okay. Got it. No worries. Yeah.
Sir.
Yeah. Go ahead. Yeah, please.
Gautam, sir.
So this is This is the comparison of the various levels of detection of the assays that we of our assays. So our assay NATSPERT, it covers, as I was telling you, 3 infections: HIV, hepatitis B, and hepatitis C. Now within HIV, we have HIV-1 and HIV-2, and also within HIV we have various genotypes which are covered. So this is just a kit performance slide wherein we have used standards, WHO standards, and we found out that what is our limit of detections and what are the strains that we cover. And obviously, these are based on data from across the globe. So all the important strains and all the relevant strains are covered, and the level of detection is mentioned over here. This is just a comparison with other NAT or nucleic acid testing assays available. We had the advantage, I must say, of hindsight. So we were perhaps the last company out of the 3 to have developed the NAT assay. So we knew that what kind of sensitivities or what kind of LODs were available. So when we were developing our assay, we ensured that we at least met the standards, and in most of the cases, we were actually able to detect at a lower level of limit as compared to what is being done by our, other companies from like Grifols and those for the madness. So it's kind of repeating. So it's a fully automated system. We can do 16 samples in each run in one module. So I again emphasize on this particular point, the capacity of our instrument is not 16. The capacity of one module is 16, and we can obviously integrate it. That's something we've already done in India for some blood centers which have high throughput, and then we can do much more samples than that. For example, 64 if we integrate 4 machines together. Being fully automated, very low hands-on time and very little human error possible. Next slide.
So this is a video of the Compact DX platform that
There is no volume, Markham.
I think, Markan, we'll be covering this anyways when you do the actual demo.
anyways, that we are demonstrating it. So that's it from the presentation part, sir. So shall we,
Okay,
if anybody has any questions, you can feel free to ask.
Yeah, so I think the people are here already know about molecular biology, I'm sure. We got a basic idea in how it works and so on. So mostly a technical when they look at the instrument and how they're operating and so on. So then maybe it will be helpful for them to come up with some questions. Yeah.
Sure. So shall we go with the demonstration, live demonstration?
Yes, Makan. Yeah, please.
Okay. Thank you so much, sir.
Thanks, Karthik.
Thank you.
So, Makan, you have to tell a little bit about where your lab is located, so they may be interested to see,
Definitely, sir. Our lab is located in area called Baner in Pune city, in India. It's in the western part of the India, and
close to Mumbai.
Yeah, close to Mumbai. It's roughly around less than 200 kilometers from Mumbai, and our research and development facility is quite huge one. It's more than 40,000 square feet in total area, where the R&D part of the for the reagents and instruments is done. And apart from that, we have a production facility close to near 60 kilometers, approximately 60 kilometers from our head office, where the reagents and instruments are manufactured.
Okay, sounds good. Yeah, I think that's good enough. So they can go and Google it and search for it. Thank you.
Definitely, sir. It's all available on the internet, sir. Yeah, we are going for the live demonstration. So we'll switching the caps. Are we audible, sir?
Yes, Makan.
Yeah. So as you can see, the instrument is right in front of us.
Just a moment, please. I will ask if everyone have pinged your video.
Yes, it's
thanks,
Amrita. Yes, Amrita. Yeah.
Yeah. Hi. Good morning, everyone. So I'm Amruta, and I'll be doing a live demonstration of Compact DX. I hope the machine is visible on screen properly.
Yes.
Yeah. So this is sort of the frontal face of our machine, Compact DXL. There are majorly two parts of this machine. One is the lower part where we have all our consumables, all the samples placed with the robotic arm inside. And the other part is the screen where you can see the actual processes happening. So once you start the machine, so there are these 3 different buttons given on the frontal face of the machine. This is for starting the machine. This is for the light inside the instrument. And this is for UV disinfectation. So once you start the machine, after initialization, we can see this particular screen where we have given a unique ID and password which will be provided to the customer. So once we log in, the screen right now is displaying different modes in which the processes can be conducted. So
Sir?
these are 3 different modes in which the processes can be conducted. One is extraction only. The second one is PCR only. And the third one is a complete cycle, which has extraction and PCR happening all together. So now we'll select complete cycle. In the drop-down menu, you can see different types of protocols for different kits that we have here at MyLab. So we will be selecting NAT PCR 16, which means 16 samples will be processed for NAT at one go. Here we have to give experiment ID. Once you press submit, you will be taken to the sample entry screen. Now, these are the consumables that we have already seen in the presentation. This is our universal cartridge. Is it visible?
Yep.
Yeah. So the first initial part of the cartridge has all the pre-filled extraction reagents, including lysis enhancer buffer, magnetic bead, and wash buffers, and elution. The second section of the cartridge has all the plastic consumables, which is piercing tips, 1 ml filter tips, 200 microliter filter tips, and in the next section are all the PCR consumables and reagents.
Okay.
Yes, sir.
Amrita, so I'm sorry, maybe a little naive here. So when you open the cartridges out of the box, right?
Yeah.
So there should be an aluminum seal on the top of all the reagents, right?
Yes. Sir, I'll just tilt the cartridge.
Okay, yeah,
Sir,
okay.
the cartridge, because sir, we are demonstrating not from a fully packed kit. So once you receive the cartridge as a product, you have the product is in a fully aluminum sealed in an aluminum pouch. It comes as a standard, and moreover, the components, individual components are sealed as well. So you can see that.
Okay.
So,
Okay.
there is a cover
But
on the top of these reagents, these part as well. And the cartridge
okay.
has a barcode linked to its identity, that is the production date, batch number, etc.
Okay, got it. That got it. Okay. I can understand the first part of extraction fully sealed, but the second part, Amrita mentioned about the tips. This is already incorporated in the cassette, or we have to add it?
No, sir, it comes as a standard package. You just have to add the PCR components. It's just the snap fit tubes. These comes as a separate in a separate box. You just have to add and press it. That's it. Just
No.
everything comes
So,
in the cartridge.
Bakan, again. So
Yes, sir.
the first portion of extraction reagents completely covered with aluminum thing. Okay, that
Yes, sir.
aluminum coverage I can understand. The second part, have consumables which will go and pipetting and other things. There are 6 pipetting tips. These tips already inside this cartridge and covered and come.
Yes, sir. It
Yes.
comes already. It comes as a full set. You have all the tips and everything
Yes.
pre-added into the cartridge.
That is
So-
my question. Okay, good. Okay, so then yeah, so then proceed it. So what is there any pipetting step except sample addition?
Sir, sample. We will proceed with that, sir.
Okay.
So you just have to place these cartridges
Uh,
on the instrument deck.
I have another question before you putting it a little bit. So Amrita and Makan. So
Yes, sir.
can you show the cartridge, please?
Sure.
Could you please show the cartridge? Okay. So now the aluminum coverage, aluminum seal is closed for extraction side.
Yes.
But you have to remove the consumable side cover before you putting it.
Yes.
Yeah.
Yeah, because you cannot just leave it. You have to open up the extraction side.
Correct.
Yeah.
Yes, sir.
So, but aluminum cover for the extraction, you don't need it to, because it will go on pierce and take it.
Yeah.
Yes, correct.
So it comes with a tight wrap coverage inside the aluminum. You just have to remove it. It's a thin plastic film wrapping. You just have to remove it, add the cartridge as it is.
Okay. So let me confirm it. So there is a 2 types of a seal or cover for the cartridge. Okay, primary and secondary. Okay.
Yeah.
So the primary cover will have extraction reagents covered with aluminum, and then PCR reagents also covered with aluminum. Okay. So then there are 6 tips in the middle for consumables. Over this,
Yes.
there is one more cover comes as a shipping coverage.
Yes, sir.
You
Yes,
just
sir.
need to
Yes, sir.
remove that one.
Yes. It
Okay.
comes covered with a thin film. You just have to remove it and place the cartridge.
Okay.
So one more thing I would like to add, these tubes comes as a separate. These are snap fit tubes, as you can see. So PCR reagents have -20 storage. This cartridge has a storage of room temperature. So you just have to take out these tubes, just add it, press it a little bit. So these are snap fit tubes. Once you press it, they will be locked into the cartridge. Then you have to place it.
Okay. So this, how many tubes?
Only 2 tubes, sir.
Okay, 2 tubes which will become as -20 shipment. So you have to
Yeah.
open and leave it a few minutes or something into room temperature and put it snap here and run it.
Yes, sir. Or you can directly snap, because these tubes will be utilized after extraction. So by the time these reagents are picked up, it's already at room temperature.
All right. That's good. Okay.
So you just have to place the container.
Hi, hello. So we're a little confused. So when you open the box and with the kit, and there is the rack or the cassette, and the tubes, the consumables comes in the rack or and separate, and we have to put in the middle.
Okay. The question is this from Alejandro?
Yeah.
Oh, okay. Yeah, I can hear your voice. That's good. Makan, the question from Alejandro is, of course, so there will be a 2-box shipment. One is a cartridge shipped at room temperature. The second box is PCR reagents comes in dry ice shipment, correct?
Yes, sir. That's correct.
Okay. Yeah, Alejandro, there is 2-box shipment.
Yeah, and the 2, I think they say 2 refrigerator. So there are 2 tubes, but the consumables and the tips and the other tubes, they are already in the rack, in the cassette, or they come separate.
Okay, so
In the middle.
Yeah, the cassette have all the reagents and everything loaded except PCR reagents.
Yes, sir. Those two
Okay.
tubes you have to just add.
Yeah, Makan, let me, yes, okay. The cartridge, the master cartridge comes with all the reagents for extraction except PCR reagents. There are two tubes. So once you remove the primary seal out of cartridge, you bring the PCR reagents. There are two tubes, specific location clearly mentioned in the cartridge. You just have to take it and snap it, and then you can put it inside.
I think the question is about the pipetting tips, if they are already in the cartridge.
It is
or...
already.
Yes,
that
yes.
is what my question itself. It was already inside the cartridge. You don't need to put any tips. It's already inside the cartridge.
Yes, that was the question from Chaco.
Yeah, tell to Alexandra. Yeah.
Yeah, I
Entonces-
understand. Sí, entendí, pero parecía que venía separado. Por lo que escuché o por lo que supuse, pero por eso nomás. Pero entendí.
Okay. Feliciana, raise. You have some question, Feliciana.
Yes. So if you use just extraction or just qPCR test, you lose the other reagents, right?
Feliciana, I know that but this is strictly for our NAT test together. So no need to bring that variable. So we are not just using for extraction or only for PCR. For NAT test is complete, but they have separate cartridges. If you just want to do an extraction, there is a separate cartridges that you can use it just for extraction for different kits.
Okay, so it's different parts, just to extraction or okay, thanks.
Okay, I have one more question here, Makan. So
yes, sir.
You are not loading the sample. So where do you load the sample?
Sir, we will show you right away, sir.
Okay. Got it. Maybe I am too fast. Okay, no problem.
No, not a problem, sir. So as you can see, these are, you get these blood from blood bags, from donor bags, you get blood samples in the EDTA box. Are you able to see it, sir?
Yes, Makan, yeah.
So what you have to do, like any other procedure, you just have to centrifuge that vial 1500 RPM for 15 to 20 minutes, like you do for any standard procedure for separation of plasma from the blood RBCs. Then what you have to do is you gently have to take the cap off. So you start early. Since this instrument is an R&D model, we do not have that the integrated barcode reader in the device itself. So once you have a production ready instrument, can you see, sir? Here you have an integrated hardware integrated barcode reader where you just can scan the barcode, keep the sample. But here we are doing outside manually with the wireless reader.
Okay, let me explain if everyone understands. So what they have here is a little bit a prototype. That's why they are doing with the external barcode readers. But the one which we are going to get is integrated barcode scanner in the front side of the extraction system. So you don't need to do with external scanner. So it's automatically integrated. You just scan and open and put the tips inside.
So then you proceed with scanning the cartridges for the detail. As you can see, there is the details of the extraction cartridge is available. The PCR cartridge is not relevant here. So we are just mentioning number. And then it is important to assign a task. So for unknown samples, we have to assign it unknown. If you are running controls, for example, negative control or positive control, you have to assign the controls accordingly. So first sample is there. So likewise, we have We have to proceed with other samples. Yes, sir.
I have a question here. So, do you have a loaded controls or something, or no? We have to make our own control samples to run.
Controls are provided upon request to the customers. We do manufacture controls, but we do not give with the extraction kit. They are given as a separate product.
Okay. Yeah. Okay.
So as you can see, you just have to load the samples here. And you can see that it's detecting a consumable. If you have not kept the required consumable here on the desk, it will give you an error warning. Until unless you place that consumable, the screen would not move. So it would mean that the system makes sure that before the run is started, all the required consumables, the cartridge, the reaction chamber are in place.
Okay, got it.
And Amruta, one question. The sample tubes and
Amruta.
Yes, sir.
Alex have some question.
Okay.
Yeah. The sample tubes and which volumes are compatible with the equipment, 3 ml and or 5 ml.
Sorry, I couldn't hear you.
He's asking about this. He's asking about the size of the tube because there are different presentations for different milliliters of sample. Which one is the correct size?
So let me show you from. Do we have one blank tube? So it's a standard 4 ml tube that is used routinely for the laboratory. Can you see it clearly?
Yes, we can
4
see it.
ml purple tab.
It's a standard EDTA tube.
Okay.
Yes. We will show you again here. So is it visible?
Yeah, you have to go a little further down for.
There is a sign that you must reach.
Okay, no worries. I will show you from the laptop front cam. So can you see it now?
Yeah.
It's a BD standard 4 ml tube.
Okay, got it. That's okay, Makan. So the Makan, let me put very simple. Of course, we don't need to be sure about. So in 4 ml blood tube, okay, so you may have some type. What is the minimum volume of plasma needed to start this reaction? Because sometimes people not taking 4 ml, they may have only 3 ml or sometimes 2 ml of whole blood. After centrifugation, what could be the minimum volume of plasma? That way the pipette will take it appropriate amount of material.
Sir, the minimum amount of plasma that is required is 1.2 ml. So for the ease of use, if you go through the instructions for use document, we have given a marking also. So if you see from the bottom there where the stickers are placed, from here to the down 1.45 centimeter marking, we have made a marking also for the ease of user, just to compare and see. Till this level, at least the plasma should be present. Otherwise, the system will, the pipetter will pick up the blood.
Understood. So, okay, Itzel and Alex. So there is a QC criteria before you load the tubes. So in the IFU, they have mentioned for easy, not to just, we don't know whether it's a 1 ml or 1.5 ml or 2 ml. So they make it easy for the lab operator to check it. There is a clear marking, like a conventional way, up to the label, this level or that level. So what could be the right range? So if you are using BD tube as it is, if something like people using other tubes, so they have to make their own assessment and make a label and keep it as a QC.
Yeah, it's because they have an additive, so you need the sample until the mark to be properly taken the sample.
Yeah.
Mhm.
Yeah.
Great, thank you.
So, okay, no issue. This and we will start with the procedure.
Yeah.
So, we have add. Is it visible now?
Can you go to the screen a little bit closer, please, if possible?
Yes.
Just to see. Okay, we are running as per the machine. How many samples we are running?
Yeah. So as here you can see that we can run all total 16 samples, or even if you have a single samples and a single sample or a couple of 2-3 samples, you do not need to wait for the process. You can just start it. You just have to select the designated wells. This is 1, this is 2, 1 to 8, 9 to 16. And this manufacturer prototype, you have markings here, numbers. So whichever well you have kept, you just have to add the samples. Can you lift it up, please? You just have to mention in the which well number you are putting sample there, and you can process it.
Okay, hold on. Just one more things. This is a random access, or we have to run as a batch?
Sir, right now you have once you can run even individual sample, but a random access feature is not available if you are running a protocol of 16 samples at a time. However, if you are running a sample of 8, a smaller batch size of 8, then you can do with a random access that in the manufactured version of this instrument.
Okay, so let me explain. So this is really important when there is a continuous sample coming. So you have 8 and 8. There are 2 separated processing unit. So if some people have just a 8 sample, they can start with one side of the machine. Then you may get some 5 or 6 later. Still, you can run in the second partition, loading of 5 samples to start running.
Yes, sir. That you can do later.
Okay.
That and the instrument has another feature, so that once you have the extraction procedure is complete and the tube goes into the PCR, you can again restart the extraction. You can just clean the deck, put up the consumables, and do another round while the PCR is going. So your screen will show 2 bars, one for the previous run, the PCR part. We will show you. Can you just lift it up? Now we will proceed with the then you just have to click.
There is another consumable that goes in the extraction kit, and it is this 5 ml reaction tube. So this reaction tube, if you can see, comes already pre-filled with lysis buffer, and this is the tube where the entire extraction reaction takes place. So that tube is placed behind the samples on the deck.
Here. This one.
Okay,
just have to open the cap. You just have to open the cap and you have to keep.
So you just have to unscrew the tube and place it.
Okay, I have a question here.
Yes.
Yes, sir.
So this extraction buffer comes with the preloaded tube per cartridge, correct?
Yeah, per cartridge.
Yes, per cartridge.
Okay, so then if we order 32 cartridges, it will come 32 tubes individual.
Yes, sir.
Yes.
It will come with 32 tubes, 32 cartridges, and 32 PCR in -20.
Okay.
Everything that is required for a single reaction, from tubes to all-in-one cartridge to PCR, everything comes as a package, sir.
Okay.
And I have a question. I don't know if I understand well, but you can open the machine while the PCR running tests are performing. So you can put like 8 and 8.
Yes, sir.
Yeah.
You once the PCR process is started, the instrument, the PCR part is properly sealed, so it is not hampered with whatever processes you do. You can open that deck. You can remove the cartridges. You can clean it, and you can reload and rerun it.
Okay. Let me confirm the same question here. Let's say you loaded 8 reactions, okay, or 8. So the PCR will run at a time 8 or 16.
Sir, PCR runs at a time. Whether you add 8 reactions or 16 reactions, PCR will run at a full capacity of 16.
Say that
minutes.
again. How many reactions the PCR will run?
Sir, if you are loaded 8 reactions, the PCR will run 8 reactions. If you have loaded 12, the PCR will run 12. And if you have loaded 16, the PCR will run 16. That is the maximum capacity.
No, yeah, exactly. So we are coming the last. So maximum capacity is 16 reaction. Whether 16 you can run 1 or 16, it will start.
It will start.
Yes.
Okay, that is clear. Point number 2. So is there kind of some indication when you load, let's say 16 cartridges or 8, then the machine started PCR. So we have to objectively see, okay, PCR is started from the screen, then we open, or there is a safe time to open, because we have to tell clearly that when we can open it.
Sir, we will demonstrate it on your screen.
Very good. Very good. Yeah.
So as you can see, once you have added everything, you just select the run, click the run button and start the protocol. We will close it now. So once you have started, can you see a progress bar? Can you just enlarge it? The progress bar. So as you can see, the complete cycle, where here you will see the process PCR has started. Once after the extraction is completed, you will see the PCR part coming here. So once you see that on the screen, then you can safely open it.
Okay, got it.
Okay. So as you can see that this instrument has started piercing the cartridges, and it will go on with doing its process. So it's better because we are handling samples here. We will close it.
Yeah.
And another feature, can you just lift it up? So once your PCR has started, so when you are doing a processing of simultaneously one PCR of one cycle and extraction of another cycle, you will see 2 progress bars here. Just like you can see, you will see 2 progress bars. When you will enlarge the first one, you will see the progress of PCR. When you will enlarge the second one, you will see the progress of the extraction part of this next one.
Understood. So currently,
yeah.
So you can open the door even in the extraction cycle.
Yeah, once this part is completed, and here you can see the PCR is ongoing on the screen in the place of complete cycle. In place of complete cycle, you will see PCR here, PCR process. Then you can open it.
Okay, Mark, the question is, okay, once you started the extraction, are you still able to open the door?
Sir, the door, you can open the door, but it's not advisable because
exactly. So
because of the biosafety measures, but the door you can open.
That's true. So currently you start with extraction, or
it has started with first it will go do the extraction. Right now you can see if it is picking up the samples. If it's visible to you, the pipette is picking up the samples. it is transferring the samples into the reaction tube. Then the extraction process, the lysis of the sample.
How much time the extraction, Makan?
Extraction takes around 1.5 hours right now, but in the advanced mode, we are increasing the speed with the software. We were trying to bring it out around 1 hour, 1 hour 10 minutes. So the whole process extraction to PCR takes around 3 hours. So that would mean that, sir, when you start your instrument, your first results for 16 samples will come in 3 hours. But since the instrument has a feature of parallel processing, it means that after 1.5 hours, when your PCR of the first batch start, you can start with the extraction of next batch. So the next set of 16 results you will get 1.5 hours after the first one. So that means that at 4.5 hours you will have result of 32 samples.
Okay, so every 1.5 hours we can add it. So that means 6 times. In 9 hours, you can process 6 times 16.
Yeah, the first one will take 3 hours. After that, 1.5 hours, 1.5 hours, 1.5 hours.
Okay, yeah, makes sense. Yeah.
And because I have a question, and there is a reason why you put 4 and then no, and then another 4 cassettes. In the first 4 places, you put 4, and then you put, and then another 4. There is a reason, or just?
No, they are just doing demonstration, Alejandro. So they did not put. They just want to show that the both partition is working for us, just to make sure.
Yeah.
Okay.
Yeah, just for demo purpose only. There is no reason that they have to leave the second 4 in the first partition. They just want to show that both module is working.
Okay.
And one more thing I wanted to show you that from this tab you can go to the history and you can see the previous runs. So results are accessible anytime, irrespective of what stage everything is running. So as you can see, it will give you a brief result consolidated of 16 samples, 14 samples, whatever you have put on run. You can go to the analysis part and it will show you the graph, fluorescence graphs of the samples, the targets that have came. For example, you can see that in the first sample that we have run, it's a mixed infection sample that we have tested here. With a known viral load of HIV known viral load of 10,000. You can see the amplification of both HBV and HIV here. So likewise, it will give you a graph. So you can partially see the analysis as well. And here there is a button for sharing. You can print you can either, if you want, you can direct, if your printer is configured, a wireless printer is configured to the system, you can directly print the result, or if you wish, you could share these results directly over email of the respective user as well.
Yeah, Makan, so the software file can be run in separate PC?
Yes, sir. I will show you, sir. You can put 2 things, sir. The first, you can directly email those results as I have shown to any person. If, for example, instrument is kept in the lab, but the result has to be transported to the front desk of the laboratory, the results can be directly mailed to them, or I will show you the LIS feature, sir. Just give me a minute.
Not a LIS, Makan. So
yes,
the
sir.
raw data, if someone do not want to stand here to check the raw data, so
yes,
the raw data can be open in another computer and analysis.
I will show you. Yes, sir. It certainly can be opened in another system. I will show you, sir. Just give me a minute, sir.
And I have a question to confirm. So in our blood banks, and they always want to put one sample if it's urgent. So they have to wait maximum 1.5 hours to put one urgent sample, for example.
Can I share my screen, Dr. Kannan?
Yeah, Makan, 1 minute. Makan, 1 minute. Alex, have a question. Yes, Alex, as this machine work in 8 and 8. It doesn't matter whether you run 1 sample or 8 samples, either urgent or routine. If the machine is running, you have to wait until the current process move to PCR. That means 1.5 hours of extraction is the dead time. If you need to run any sample, you have to wait for 1.5 hours.
Okay, thank you.
Okay, so I'm leaving here, Makan. So
sir, could you just be for 1 minute, sir? I will share my
yeah,
screen.
okay, I can be there. No, not this one. I can be there. So I mean, like.
So as you can see here from a different system, I am opening the results of I have a login credentials which were used on this device. We have a dedicated system as well as it can be configured to either to your blood bank, or you can use this a portal as well to see the results. As you can see, if I select here, I will see my device which is attached to it. I can see all the past runs and I can see the analysis that I have shown you there.
Okay.
So that's the same analysis that you have seen on the screen that you can get here as well. On a remote laptop, on a different laptop. If you do not want to go into the lab, you once you log into this portal using the same ID, you can see the result they have.
Yeah. Good.
So I think that this answers your question that you have asked.
Yeah, absolutely. Yeah, because I don't want people to sit all the time.
Absolutely, sir. That's why we have made it. Either you want this data directly to be shared to your blood bank LIS or hospital LIS, that is also possible. Or if you want to see all the analysis, you can just log into this portal. This is on online portal where you make your own login ID and password. It just checks and connects to the device that is attached to your lab. Then once it's paired, everything you can see on this portal itself regarding
okay, good. One more question. So since you asked me to wait here, in terms of every batch or something, okay, if the lab want to adjust some city values or something, we will adjust it, or it comes like a default software, we have to use it.
Sir, right now the software is in a default mode, but we are currently upgrading the software where we will give the users a feature of automatically adjusting thresholds, setting the thresholds as per they do, just like they do in Biorad or Quant Studio. But they can do that software is in development, and hopefully within a couple of months we will have that feature as well.
Okay, at the moment, so the one which we have, okay, couple of months means we will get the new one in 2 months.
It's a software. So the software, as you know, the software development is a continuous process. So it keeps happening. The system will get updated online on its own. So it's not a problem at all, sir.
All right, that's good. Okay.
And the other equipment that is for 8 samples, and it's we can put another sample in 1.5 hour too, or it's different.
It's
Could
okay
you
because
repeat the question?
yeah, you
could
can
you
talk,
please-
Alex. You can get a mess because his voice is kind of little breaking. Itself, you can check with Alex and ask the question to them.
Sí, pueden repetir la pregunta porque se escucha como un poco de hueco o decirlo en español, como prefieran.
The Compact DX that is for 8 samples. We can put another samples like the DXPL in 1.5 hours because there is only for 8 samples.
Okay, yeah. Okay, I got the question itself. Can I go ahead?
Yes.
Okay, yeah. Makan?
Yes, sir.
Makan and Amrit. Makan.
Yes, sir.
Okay, so the question from Alejandro is, okay, so this is a dedicated blood bank lab. They are getting continuous samples. Okay,
Yes,
so in this case, okay, you are running one machine, 8 samples or 16 samples, whatever, but still you have to wait for this extraction to finish to go for 1.5 hours. Okay, so of course, as a lab, they always have a backup machine, second instrument, right?
Yes,
So if they run extraction in one machine, then they can bring the cassettes, then they add the PCR reagents in another machine to start running it. It's possible.
Sir, there are 2 options that you can use in that scenario, sir. First is if you have
But before that, just 1 second, Makan. 1 second.
Yes.
Alex, my question is correct?
And I think no, because I asked for the Compact DX.
Okay. Compact DX, not
Yeah.
DXL.
No, it's just
okay,
because
okay.
I'm thinking.
Okay,
Which,
so Makan, Alex
Yes, sir.
asking, you have a Compact DX just for extraction, right?
Sir, that is also a device that is fully automated that does extraction. The only difference between DX and DXL is that on DX you can process 8 samples at a time. On DXL you can do 16 samples at a time.
But is there a swapping possible that you can extract in one machine and bring the cartridge to run the PCR in another machine?
Sir, you can do that, but if you have another machine, you might as well do the full sample processing on that system itself. If you have a larger throughput, for example, if you have 16 sample continuously running for an hour, what we offer is as a customized solution that where you can see the instrument. This another copy of this module is added into the same frame operated from a single software. So once you start 16 samples with this, once you have another set of 16 sample, let's say coming after half an hour, you run it on the other module. You have so in 1 hour you have pushed it 32 samples. Suppose after another hour you got 16 samples. So by the time the first instrument, the first module will have it's completed its extraction, it will be ready for another sample taken.
But in the additional module or additional machine is easy. That part is it's okay. But the major point is to have the. Okay, let me put it in this way, Alex. Alex.
Yes.
So I think independent module work as it is, but for a stat sample, just like a one sample. Okay, so. Makan said, if you have an additional instrument, there is no point you do the extraction only. So you can just directly using that machine for running a stat sample. Okay.
You can do the full sample to result process on that the additional backup system that as well.
And also, Alex, they also have extended module system. I already talked with Makan on that. That means one master unit controlled from one software that you can attach another module with the same software that you can keep one portion of that machine for a start procedure. That means every control will be from one operation that you keep for one extraction and one PCR as a backup. You can combine basically with the software and all everything same, or you can run independent module. So either options is available.
Great.
Sir,
Thank you.
Rahul sir is here.
Hello, Dr. Kannan.
Yes.
Hello, everyone on the call.
Hey Rahul, what's up?
All well. How are you, Dr.
Hello.
Kannan?
Everything good here. So thanks for joining.
Yeah. So this interaction was long due, and thank you for everyone for being on the call.
Absolutely. So yeah, I mean, it's very interesting so far. Makan, Amrita, and Gautam. So we're just starting to learn. It's easy process, but still, like as we discussed, once we have this online demo, it would be great to organize one training for our customers in Latin America.
Yeah, of course, we can get that done. In fact, good to see you in person for the first time.
Oh yeah, that's true.
Yeah. So what I in fact suggest is, it will be a pleasure to host you all in India if there are any travel plans. Of course, we can send a system to the respective countries and have a demonstration done there. That should not be a problem at all. But if there are any travel plans, do visit us. We have our Global Innovation Center very near to Mumbai, just couple of hours drive. And we can really showcase some of the wonderful technologies apart from compact DXL that we are working on. So
okay, sounds good. Yeah. So yeah, that's a separate conversation, but definitely after we finish this demo, if we bring one instrument, so because currently we are focusing on Mexico, Peru, and Paraguay, so it depends on the common availability. So we can organize a training in US or in Mexico or Peru or Paraguay. So that way we can be easy organization rather than India trip. But definitely my team and our distributors are eager to visit India. So maybe in a year one, maybe we can have some sort of a training meeting and so on for sure. Yeah. So for now, let's proceed with this one. Demo in this side of the ocean would be a starting point before making India trip for sure.
yeah, sounds great. So as we spoke earlier, sending out one system for demonstrations and training should not be a problem. Post this meeting, you all can discuss together and let us know the modalities.
Sure, Rahul. Thank you very much. Yeah.
Over to you, Makan.
Yeah. Okay. Makan, so I'm as mentioned that I'm leaving. I have another meeting to drive to lab. So Itzel will be here. She is our application lead. Feliciana also for Brazil. So on LATAM together, and I don't know whether they all introduced. So it's a time for me to introduce my team here. Itzel.
Hello.
Yeah. So Itzel is yeah, you can tell briefly, at least until the machine is running.
Okay, so I am application specialist from Labsystems. I am covering all the Americas countries.
So then we have Feliciana joining from Brazil.
Hello, nice to meet you.
Yeah, Feliciana is our application specialist from Brazil. She is closer to Paraguay, so she will be taking care of Paraguay as well. And so then we have a sales manager, Vanessa. She is managing the South America business for us. Vanessa.
Hey, Dr. Harry. Nice to meet you. Yeah, I'm the sales manager for South America. We are working on new customers and see new prospects for Brazil and also the other countries.
Good. So then we have one R&D and application from US, Jian Chen, Dr. Jian Chen.
Hello, everyone. Nice to meet you guys. My name is Chen, and I'm a R&D, as Ken said, based on Houston lab.
Yeah. So we have 3 application specialists covering Americas, and so Vanessa managing business side, but all of our team people are quite a bit on the molecular biology space, so they can capture it. So one person missing here is Edwin. Edwin is managing business for Central America. So we are at the moment around 10 people team, and so we are eager to start with my lab with Triple H product. I mean this. Then we have opportunity to grow for other products that we will discuss later. Okay, with this, I think you please continue, and if you have time and so on, so whatever the way. So I may be joining after 1 hour when I drive to the lab, when I look at the data, how it looks like. So, all right, thanks Rahul, thanks Makan, Amrita and team.
Thank you so much, sir.
Thank you.
Thanks
bye.
a lot,
Thank
Dr.
you.
Kannan, for scheduling this call. Take care. Bye-bye.
Thank you. Bye.
Thank you,
Yeah.
Kanan. Bye.
Yeah, and absolutely,
Thank
delighted
you.
to meet all of you. We are my lab is absolutely excited to see Compact DXL in action with all your expertise, and with all the stakeholders being there. We also feel absolutely confident that the product would be in action in all your countries very soon.
Yes, sure.
Yeah. So, I will not interrupt the flow of the discussion anymore. Makan, you can take over, and let's continue the discussion from where I jumped in.
Yeah. So anybody else has any questions? I will be happy to answer.
Alejandro, do you have any questions? I think you were about to ask something.
Oh, but I was thinking, what is for the best if my client have one compact DX or 2 compact DX, in order talking with the time of the donors that in 1 hour or 2 hours, and the donors come like 8 or 10 donors. So maybe it's for the best having 2 DX in order to process if it's necessary one urgent sample. Or I don't know, but in your experience, if it's for the best 1 equipment and 1 DXL or 2 DX.
Sir, your voice is echoing. We are not able to understand clearly.
Well, he is asking about, in your experience, what would be better, to have 2 compact DX or maybe 1 DXL and 1 DX in order to have a better configuration for urgent samples because of the bank donors?
To my understanding, anyways, any standard laboratory requires a critical backup. Any instrument that is critical, it requires a backup. So depending upon the workflow. So if you have a workflow of, let's say, 70 to 80 60 to 80 samples a day, a DXL as a main instrument or and a DX or as a backup instrument would suffice. But if you have more workload, so for example 80 to 100 or 80 to 120 samples, then having a bigger module where 2 DX modules, such modules are combined, and a single module as a backup would be sufficient. I think Rahul sir and Gautam sir would be a better person to answer on this perspective.
Yeah, just let me check how many samples. Alejandro, you said 8 to 10 per hour, right? Do you know how many per day? How many per day will be your batch? Or
Yeah,
I
I have
understood
to
8 to 10 per hour, right?
per day, maximum 30. It depends on the block center. But the smaller one has like 15.
For the smaller, how many?
And 15 at least.
15. Okay.
It's more because in here all of these tests are performing in one center, but it's centralized. So what we want to do is all the other blood banks that are smaller and to have one of these because we already in here in Paraguay have one center that process all of the samples. But in reality are two centers and the IPS and the center, but they are centralized. So what we want to do is decentralize some of the blood center.
Mm-hmm.
The one that is the best is 1,900 donors per month. So we have to calculate how many per day, but that is the idea because they already test this, but in one center. The idea is in the blood banks that are harder or to
So,
have.
for example, if you have 15 samples per hour, right? Maybe if you have 2 DXL is good because the first hour you are running the 15 samples, but in the second hour you are not able to run the other 15 samples. So if you have 2 instruments for the third hour, you have 1 available, right? That's what I'm understanding about this workflow in the lab, right?
Yes.
So maybe 2 compact DXL would be the best.
Yeah, I think it's talking with the client and in your experience, if they want one implement or two, but I just want to hear your experience. If you have this DXL and you are okay with this DXL. But
Dr. Kumar, in your experience, which one would be the best configuration for 15 samples per hour, for example?
So 15 samples per hour, and on an average, considering that, I would still recommend going with one system because to my little experience, blood bank works as a production unit. You do not have that hurry to report the samples. So if you can hold on for half an hour, you can. So if you are getting 15, like suppose you got 15 samples in first hour, you processed it, and you got after an hour you got another 15 samples. So if you can hold on for half an hour, you can process the next 15 sample as well. But that goes it's a very standard answer. If the blood bank has a specific requirement whether they have to process the samples continuously to release the blood bags, it would be best they should go for a 2 model. But yeah, so it's a little bit tricky. We have to think the solution as per how the customer's workflow is.
Yeah, just to pitch in, Makan, have we discussed about parallel processing?
Yeah, we have discussed it. That's what I was telling, that once you have a sample at first hour, 15 sample, you can process it, and after 1.5 hours, you can parallelly process the another 15 samples that you got half an hour ago.
Yeah, so essentially it's a case of batch processing. For the first batch, it takes that bit of time. But then at least for the extraction module, then we can have 16 samples being processed parallelly. So, maybe thinking realistically as to how things work out in a blood bank, the last lot of the day that we received for the samples, that could take, maybe that more time for reporting. But otherwise, throughout the day, 15 samples can be processed in rotation. First 15 are done through extraction, then put on to RT-PCR. And while that is being done parallelly, the next round of 15 samples can be put for extraction process.
Okay, no more questions. Thank you.
What we can also do is, recently we have installed DXL in one of the premier blood banks in Delhi, the capital city of the country. Over a course of next 6 to 8 weeks, we will try to come up with the data as to how many samples are being processed on the device in a real field situation, right? So, Makan, if we can keep compiling that data and share with the team for their confidence that, see, we can always have computations and theories, while calculating the TAT and how it works out in a lab situation. But, it would be nice to have the data from couple of sites being sent to the team here.
Yes, sir, definitely.
We already have one installation in the capital city. However, the workload that they handle is much lesser. But the site that I'm talking about, they handle close to 6,000 blood bags on a monthly basis. So that's a premier center. So our team there, of course, will compile the data and will share it with you over the course of next 6 to 8 weeks.
So
that will be perfect, because what my clients want is where these equipments are installed and how many samples per day. So it's very interesting, and having the amount of samples and how many equipment and which ones. And if we have in Latin America or Europe or India, and having that information is very important.
Sure. Enrico, I'm really sorry. I'm not sure if that's a problem at my end, although I did not hear you properly, but I get the gist of it, that you would need information on current installed base, how many installations we have here, and what sort of sample loads these installations handle. So we will present that data as well to you.
It would be great. Thank you.
So the run will take approximately about 1.5 hours. So shall we email the result to you, or you want to see the results live on the system?
What do you want to do? Do you want to stay here to see the results?
So
for me, it's okay, and we can, and if there's no more to add, you can close here, because we have 2 hours for the running, right?
Yeah, see, because we can still see the robotic arm doing liquid transfer steps for another 10 or 15 minutes. But once the tubes are transferred to the RT-PCR module, we will hardly see any action happening, any mechanical action happening in the device. So it's totally up to you. If you want to stay put, we can keep the call on standby mode and let the run progress. And any which ways, Dr. Makan would be sharing the run results as well. One more thing which can be done is Labsystems does have presence in India through the affiliate organization Trivitron, right? So I had also requested Dr. Kannan that if the team in India wants to visit our center in Pune and have a look at the system in person, even that is something which can be done.
Mm-hmm. Okay.
Yeah, super. And one observation that the pipetting is also happening in the spots that that don't have the cassette. Like the arm, right? Even if that spot is empty. Just an observation.
I'm sorry, I completely lost you, Makan. Did you understand?
He's saying that the instrument is also doing the move steps in the empty slots.
So the thing is that the instrument is designed because we have kept only 4 cartridges. The instrument is designed to perform the 8 at a one go. So if you have not added the instrument will, cartridges there, the instrument will still perform the steps. So it's not like the single sample processing. It's a batch processing. So once even if you have added single cartridge and if you want to run a single sample, you can choose to add one single consumable for that. But the system will process in the batch of 8. So first half, if you have added the sample, it will process for 8. If you added any, for example, 2 cartridges or 2 samples or 3 samples in the next part, it will still do for the next 9 to 16.
Yeah, I would like to add here. So see, the device has been designed keeping in consideration the requirements of the blood banks, who typically have a batch of samples to be processed. So more likely they are going to have the full set of samples to be processed at once. What you are referring to is probably random access. So unfortunately, at the moment, the current design does not have random access or processing of just a sample or two. But it's definitely an area of improvement, or what I'll say enhancement, that if only a minimal number of samples are loaded, the robot should only perform those many steps, and probably we can reduce some bit of cycle time in that. But as of now, since the device was the device is required to have a throughput which should be to the maximum capacity, that's why it performs all the steps as if it is handling all the samples, 16 samples at a time. I hope I could explain it.
Yes.
Yeah.
Yes. Do you have any additional question, Alex?
Okay, and we were thinking that we cannot put in the process, in the 3-hour process, because if we put one sample, it had to start like all over, because what I understand is that the machine works in batch. Understand? Because we cannot add one sample in the middle, because the machine works in batch, and the machine won't start giving 10 and all over again in the spots that already have samples are in the PCR instead. I don't know if I'm correct. So we have to wait the 3 hours.
No les estamos entendiendo muy bien. Hay como mucho eco. No sé si podrían.
Te explico que no se puede colocar a las 1 hora y media porque el equipo está preparado para trabajar en lotes. O sea que si colocas una muestra a las 1 hora y media, el equipo va a procesar todas las muestras otra vez. No va a trabajar solo en ese que colocar. Entonces sí o sí hay que esperar. No se puede agregar uno porque va a tener que trabajar en el lote completo. en todos los.
Sí. Sí. Es justamente lo que explicó, que el equipo está diseñado como para trabajar por, como por cargas, ¿no? Como por lotes. Entonces, está pensado para un trabajo, un flujo de trabajo de banco de sangre, donde pues tienen una gran cantidad de muestras, entonces va a procesar los 16. No puedes decirle que procese solo 1 o 2 muestras, que quizás más adelante puedan ellos hacer una mejora, pero por ahora no es posible.
Vale, entonces para aclarar nomás que no se puede agregar una muestra a la 1 hora y media. Aparte
Sí
de
se
eso
puede.
que ahora, pero si
O
trabajas
sea,
en lote, hay que, o sea, todas las puntas y eso van a pasar por los tubos que están siendo ya las PCR. O sea, ¿cómo vas a ver que, a eso me refiero? Si colocas la
no, sí se
muestra,
puede, porque cuando ha transcurrido 1 hora y media, tú puedes abrir, limpiar y cargar nuevas muestras.
mientras los tubos están siendo de PCR. Es como que
Es algo que podemos preguntar. Entonces, so we have a question. When we have finished the extraction process, we wait 1.5 hours, then we can clean up inside and put inside more samples, right?
Yeah.
Okay, what happened with the PCR wells, or where is happening the PCR
So
if we remove the...
as we have shown you on the screen, as you can see it, once you have the process, the PCR is started, you have run, you will see us 2 bars are like that. So both processes happening in parallel, and you will see the real-time status of that. For example, if you have the PCR process running along with the process cycle, there you can see the real-time fluorescence graphs. So those both processes will run parallelly, and until that the PCR of that first run will be completed, the system will not go for the PCR of the second batch that you have started.
creo que sí entendí y se puede porque es independiente, pero a lo que voy es que capaz vuelva a perforar la sección de donde están los reactivos para la extracción de los que ya están haciendo la PCR. No sé si se entiende. No sé si va a aplicar
Pero
en
ya,
algo. Porque sí o sí
no,
recoge todo el equipo.
pero ya tiene que estar considerado, si no, no podrían decirte que puedes cargar más muestras, ¿no? So, for example,
Vamos a ir viendo.
if you have run the 8 samples in the beginning, then 1.5 hours later, you clean and add more samples, another 8.
You can add even 16 samples. You can add 16
okay.
samples of full deck procedure. No problem at all.
Yeah, and for example, is there any problem with the PCR reaction that it's running
No,
for the
absolutely
first batch?
no problem. No, absolutely no problem. It will run parallelly to your extraction, so that the PCR is running separately. It will give you results after its due time, and the extraction will go on. So extraction will complete, and it will wait for the once the PCR is over, then it will give you a notification, a pop-up that the PCR is completed. The tubes will be discarded. The PCR tubes for the first batch will be discarded. Then the PCR of second batch will start. So those 2 processes run parallelly, and there is absolutely no problem.
Is that more clear? Yeah.
Yeah. Thank you.
Thank you. Yeah, if anybody has any more doubts, please feel free to ask.
We don't have more questions. Thank you.
So I think if everyone is okay, and if everybody agree, we can stop here the meeting, and then we can receive the results if you are okay. What do you think?
Yeah, we can share you the result. Meanwhile, it's night here, so tomorrow morning, when we come to office, we'll share you the results, how it went.
Yeah, I think it's fine. So the arm, just one more question. The arm will handle just 4 pipettes at a time, right?
Yeah.
The arm is for 4 or for 8? 8.
No, the arm
pipettes.
handles 4 samples at a time, but it's quite fast. So handling 8 samples, it does first 4, then it goes to the second 4, then third 4, then fourth 4. If you are handling 16, if you are running a protocol only for 8 samples, then first 4, then
The
5 to 8. Yeah.
4.
Second 4. Yeah.
Okay. Okay, I think I understand. I just need to think more about that because the PCR tubes is just the tube, so that's why you can swap after extraction. You can put more samples, and then you just leave the PCR tubes, and then you replace the tubes.
Yeah. The tubes, it gives you a notification, and you just have to take them out, and the next cycle is started.
Okay, just one more question about the throughput, because for example, in Paraguay, they want to decentralize the blood bank. So they probably will process 8 or 10 samples per day in these smaller centers. So do they can have just one machine?
Yeah, they can have one
in the
instrument.
lab.
Yeah.
Just one, and then for example, for backup, they can place the backup in the distributor center, and then
Yeah, absolutely. You can use that model for if you are using a decentralized system. You can use that model where you have one backup for every 3 to 4 labs. So the samples can be sent there and processed there, and results can be seen. Anyways, you have seen results can be seen or shared through emails as well, or it can be seen on remotely on the system as well. So that is absolutely not a problem.
Okay, by your experience, how long it will take to replace the machine, or does it broke sometimes, or what's the most common problem that distributor can face? The maintenance needs to be done, overall troubleshooting, thinking on that they need to decentralize this blood banking. What will be more advisable?
So Vanessa, I would like to answer your question. So these machines are very robust. In India, they are not only being used in stationary or static laboratory conditions, but they are also being deployed on mobile testing vans. So these are ambulance-sized vehicles. And in India, for the country's national tuberculosis detection program, these machines are being mounted on vehicles. And the way you said that the program should be decentralized, that's the purpose for which this solution is being used in India at the moment. So these machines are not only installed at centralized laboratories or district hospitals, they are actually being used in primary healthcare centers, which is the last mile healthcare delivery infrastructure in our country. So you can be absolutely counted on the robustness of the platform. To answer your query around what sort of maintenance or what sort of support would be required, so of course, because it has optical modules in the real-time PCR setup, so the machine would duly require an annual cycle of calibration, and it is advisable to have a preventive maintenance done once every 6 months. But beyond that, the machines would be, they are quite robust. Having said so, just like any other medical device, this machine can also have a breakdown. So we together can work out a system by which we can have a standby machine, let's say behind every few centers. So something like that can be worked out. I'm not saying that the machine will never have a breakdown scenario. Of course, that is bound to happen. But at least in India, the robustness of these platforms has been proven in both static as well as mobile operating conditions.
Okay,
And
thank you.
And regarding the service, we can have a coordinated chain of service engineers, and at a place we can have the inventory of the parts if that is needed. So that can be replaced as soon as in India, our service turnaround time is less than 48 hours. So something similar can be built anywhere as well.
Yeah, okay. Alejandro, maybe we can discuss and do this design specifically for your region based on the number of samples and also the centers. I think it's some homework that we need to do. I don't know how far Kanan went to this conversation by your case, but definitely can schedule a call and support you on that, on account all the machines needed, the thinking on this maintenance and also the backup machines. Yeah, okay, I think we can receive the results by tomorrow. It's not a problem because of your time now. It's around 9 p.m. I think by your side.
Yeah, it's 9:15.
Okay.
Thank you very much.
Okay, I think I'm okay. I don't have any more questions. I don't know about Feliciana or Itzel. Are you all okay? I think if everything is okay, we can close the call. Thank you, everyone, for.
Yeah, I'm okay.
Thank you so
Yeah,
much,
I'm good.
everyone.
Yeah. So
Okay.
thank you so
Thank you
much,
very much.
everyone, for your time and for being on the call. We are absolutely delighted and eager to work with you all. And once again, if there are any travel plans, please, all of you are welcome to India to actually see the systems in person. Thank you so much for the time.
Yeah.
Thank you.
Thank you.
Thank
Thank
you
you.
all.
Bye-bye.
Bye
Thank
bye.
you.
Thank
Bye.
you guys. Bye-bye.
Have a nice day. Bye.
Thank you.
Bye.